We've developed a new melanoma risk prediction tool. This can tell you whether you're at above average, average or below average risk and give you an estimate of how likely it is you'll develop a melanoma within the next 10 years. Treating and diagnosing melanomas and skin cancers are the most expensive cancers on the Australian health budget. We spend more treating and diagnosing melanomas and skin cancers than any other individual cancer, so it's a big problem. The tool's being designed for the general public as an aid to clinical care. It can be filled out at home, on the bus, you can do it on a mobile phone or on a tablet or a desktop. Asks you 16 questions and it gives you your risk of melanoma. The factors that we ask people to report are common things like your age and sex to start with, how your skin reacts to the sun. Some people burn when they go out in the sun, other people don't. Some people develop a tan when they go out in the sun, other people don't. This is a way of, before they get there, giving the doctor some further information about their risk. It can be used globally because we and others believe that the relativities of people scale the same across different populations. What will change, though, is your absolute risk. And even within Australia, if you live in Queensland, just by living in Queensland, you have a higher risk than people living in New South Wales, who have higher risk than people in Victoria. People can still develop a melanoma even if they're in a low risk category. So we know these tools aren't perfect, but what they can certainly do is identify people at higher than average risk, and those people ought to be offered the opportunity of some preventative action or some detection action so that melanomas can be picked up early. No one wants to have to go to the doctor and have things cut off. Even if they turn out to be benign, it's still pain and suffering and money and all of those things. So prevention is better than cure. Currently in Australia, there's discussion about whether or not we should have a national screening program for melanoma and how that might work. And it's being suggested that tools like this might help decide who would benefit most from a screening program if we had one, and who would not need one because there's other health issues people need to worry about. We hope to see how this is used clinically, so by GPs and dermatologists and practitioners, but also its acceptability to the general public, and whether or not that leads to improvements in skin cancer detection and survival in the future.